What would happen if you got hit with a $10,000 hospital bill tomorrow? And your insurance didn't cover it? Most people think they're covered until the bill arrives. But here's the truth: not all health insurance is created equal. HMO, PPO, EPO, POS, it sounds like alphabet soup, right? But each of these plan types can dramatically affect where you can go, who you can see, and how much you pay out of pocket. In this video, I'm breaking down the different types of health insurance, what they actually mean, and how to choose the one that's right for you. Because when it comes to your health and your wallet, the fine print matters more than you think. HMO is Health Maintenance Organization Plan. An HMO plan is a type of Medicare Advantage plan that generally provides healthcare coverage exclusively from doctors and other healthcare providers or hospitals in the plan's network. A network is a group of doctors, hospitals, and medical facilities that contract with a plan to provide services. Most HMOs also require you to get a referral from your primary care doctor for specialist care, so that your care is coordinated. With this plan, the insured must get care and services from doctors, other healthcare providers, or hospitals which are in the plan's network. However, some HMO plans, known as HMO point-of-service plans, offer an out-of-network benefit for some or all covered benefits. But one will have to pay a higher copayment or co-insurance if insurer gets non-emergency healthcare outside the plan's network without authorization, then he will have to pay the full cost. It's important that one follows the plan's rules, like getting prior approval for a certain service when needed. If the doctor or other healthcare provider leaves the plan's network, the insured will be notified by the plan, and the insured has to choose another doctor from the plan's network. Do these plans cover prescription drugs? In most cases, yes. If proposer is planning to enroll in an HMO and wants Medicare drug coverage, proposer must join an HMO plan that offers Medicare drug coverage. If proposer joins an HMO plan without drug coverage, they can't join a separate Medicare drug plan. The second one is called as PPO plan. PPO, or called as Preferred Provider Organization Plan. A Preferred Provider Organization Plan is a Medicare Advantage plan that has a network of doctors, specialists, hospitals, and other healthcare providers that an insured can use. With the plan, one can also use out-of-network providers for covered services, usually for a higher cost, if the provider agrees to treat one and hasn't opted out of Medicare. One is always covered for emergency and urgent care before insured gets services from an out-of-network provider. Insured has to ask for an organization determination of coverage of the plan to ensure that the services are medically necessary and that the plan covers them. If a proposer is planning to join a PPO and wants Medicare drug coverage, proposer must join a PPO plan that offers Medicare drug coverage. If one joins a PPO plan without drug coverage, insured can't join a separate Medicare drug plan. Next is EPO plan. EPO refers to an Exclusive Provider Organization Plan. This is a type of health insurance plan that requires patients to use only in-network providers for coverage, except in emergencies. This means that for billing purposes, a provider will not be reimbursed if they are outside the EPO network, unless it is for an emergency situation. For a medical bill, if a patient receives non-emergency care from an out-of-network provider, the insurance will likely not pay, and the patient will be responsible for 100% of the cost. EPO plans typically allow members to see specialists without a referral from a primary care physician. This simplifies the billing process because there are fewer steps for prior authorization to be completed before seeing a specialist. Medical drugs are covered under an EPO, Exclusive Provider Organization, health plan, but with the condition that the drugs must be obtained from in-network providers. Next is POS plan. POS refers to Point of Service Medical Plan and is a hybrid of HMO and PPO plans that combines features of both. This plan allows the insured to see in-network providers for lower costs or out-of-network providers for a higher out-of-pocket expense. Like an HMO, a POS plan typically requires one to select a primary care physician who coordinates and provides referrals to specialists, even out-of-network ones. However, like a PPO, it offers the flexibility to go out-of-network for care, although you'll generally have to pay more and potentially handle more paperwork. These plans typically have higher premiums than HMOs but lower premiums than PPOs. This plan is best for frequent travelers who want the flexibility to see a doctor anywhere. Medical drugs are covered under a POS health plan, but coverage details depend on whether you use in-network or out-of-network providers. In-network prescriptions are typically covered at a lower cost, while out-of-network drug costs are higher, and the patient may have to handle more paperwork. Alright, now you know the basics of HMO, PPO, IPO, and POS plans. Which one sounds right for you? Drop it in the comments. And hey, make sure to subscribe and stay tuned, because next up, I'm sharing real tips that could save you hundreds on your premiums.